There are many reasons why I became a physician. But if you really ask me what is the number one reason, I would say it's the desire to help people when they need you the most. When you have a heart attack, when you have a stroke, then you realize the person who is able to help you in those times is the one that you treasure over a lifetime. To become a doctor requires many years of training, lots of commitment, and some even say many personal sacrifice. But in the end, to be able to call yourself a doctor, a healer, is worth it. For me, becoming a doctor and working as a physician bring tremendous personal satisfaction. Those satisfactions cannot be replicated elsewhere. Doesn't matter how popular you are, doesn't matter how much money you make. In the end, it's your personal connection with your patients that really stand out. And those emotional bonds with your patients will sustain you, sustain me, sustain other physicians over the long term. And for that, I treasure the most. I think that's the reason, that's the main driver, that I have taken so many hardships, overcame so many obstacles to become who I am today, which is a medical doctor. I joined professional healthcare upon my graduation in the year 2004. The decision to join professional healthcare was, for the most part, an easy decision. It wasn't that difficult at all. I've talked to other people and they told me deciding which practice to join is the most difficult decision of their professional life. For me, it wasn't that difficult. Now, I will tell you why. I don't know if you have met Dr. Saba, but I still remember the day I sat down and interviewed by Dr. Saba, and he came across as a gentleman who's dedicated about his work and who truly cares about his patients. For me, I just graduated from my training. I didn't really looking for something that doesn't fit my deep personal convictions. So when Dr. Saba came across as somebody who's caring about his patient and dedicated about his work, I think there is a click between me and him that was immediate and that was rather personal to me. Professional healthcare is a professional practice, as Dr. Saba already emphasized. When I joined this practice, I continue to practice medicine with the same values and the same principle as was set by Dr. Saba. Those principles are you take care of your patients as if to take care of your own family members. And I will continue to do that. Now, over the years, professional healthcare continued to develop, evolve, to meet the new challenges of healthcare in the next century. So we are in the 21st century. The values are the same, the principles are the same, but we continue to deliver care that meet our patients' expectations, that meets our patients' needs. So it's very clear at this point in the healthcare that preventive care is an integral part in the delivery of healthcare in America. The traditional mode of medicine, we focus on an acute problem, we solve it, and patient goes home. They only come back when a new problem develops. But here at Professional Healthcare, we embrace that concept, but we also recognize that, maybe it's time for us to spend more time preventing them from developing acute problems. So you say preventive care increasingly becoming an integral part in the delivery of quality health care. And here at Professional Healthcare, we continue to embrace our values and our principles. At the same time, we continue to evolve to meet the new challenges as well as to continue to meet the needs and expectations of our patients. That's something we continue to focus on.